Interview segment, the National Program Manager of the Saving 1 Million Lives Initiative, Dr. Ibrahim Kana, speaks about plans to review the program and how states have performed following the disbursement of funds to them. Watch. Dr. Ibrahim Kana, you're welcome to the program.
Thank you, Gloria.
Well, let's begin with the Saving 1 Million Lives. I mean, this is an initiative Nigerians were happy about when it was launched by the former president. Okay. And now, what is the status? Because it looks like it's neither here nor there.
No.
Bring us up to speed with that.
No, certainly we know where we are.
Okay.
And I certainly when this government came in, actually decided not to change the system because it's a program that was deemed to be successful. And what the government did in 2015 was to reinvigorate the program, inject new ideas into the program, because the focus really is about mothers and children of Nigeria.
Exactly.
And that was how the P4R, came into being. Now, the program was redesigned, to ensure that we put states in front. The government realized that we as a federal government cannot continue to deliver healthcare without working with the states. Take note, no federal government has no single primary healthcare center in Nigeria. All the PHCs are actually owned by the state and local governments. 1, 2, the federal government does not own a single secondary facility in Nigeria. Whether you call it general hospital, specialist hospital, cottage hospital, they are all owned by the state. Federal government only owns the federal teaching hospitals and the federal medical centers. Therefore, government realized the fact that to deliver healthcare, most population of Nigeria, particularly mothers and children, actually access healthcare through the primary and secondary facilities, and they are owned by the states. So the federal government decided to work with the World Bank. This time around, working side by side, but strictly speaking, putting states in front. We are going to raise these funds, but we are going to be giving you the funds to deliver services to the people of Nigeria. Now, I think the federal government needs to be commended in this regard, because a situation where federal government will take a credit and giving it out as grant to the states, I think is something worth mentioning.
But you're saying that since the plan to, the renewed commitment, on this program, you're saying there's been more funding?
Yeah, correct.
There's been more funding.
As a matter of fact,
Talk
yes.
about that, please.
Yes, certainly. You see, so what the federal government did was to set what you call disbursement-linked indicators, specific indicators that needs to be measured. These indicators are indicators that are directly related to improvement in health of women and children under 5, i.e. ensuring women go for antenatal, ensuring women are delivered by skilled labor in facilities, ensuring children actually are immunized fully, ensuring children actually have the best nutrition possible, ensuring that actually women under the reproductive age have access to modern contraceptives. Now, what the federal government did is to skillfully design this and attach to each state, making each of the states to compete with itself. Now, state A, if you achieve this improvement every year, we're going to give you this amount of money. Therefore, federal government actually brought up to $500 million. But the funds will be seated in the Central Bank of Nigeria, waiting for the states to perform. Up till today, the states have actually been able to access only 50% of the funds 4 years after. Why? Because states have not performed to gain access to the money.
You see, this scheme is all about expanding access to primary health care.
Actually, yes.
For women, children, and the likes. Now, and you were telling me that just 50% of the initial fund, $500 million, has been assessed. That means, so there are a lot of states doing nothing. Results not shown as we speak.
Correct.
So would you say that is progress amidst the renewed commitment to reinvigorate this? Where are we on this matter?
Yeah, so now if you look at it, we decided to disaggregate the states now into individual states, no longer looking at the country as a whole. Because whatever we want to do, if you look at attaining universal health coverage, is the aggregate of the states that we put together to say we have achieved this percentage coverage in immunization, in all whatnot. But the focus now is on each individual state. Remember, in the past, it's so easy for everybody to come out and say, we have invested 50 billion naira in healthcare in my state. Each governor can come out and say that. But now, it's no longer like that. Yes, we have invested. What is the result? That's what the program is talking about. We're not talking about how much investment, but how much result have you achieved. Now, so what the federal government has done really is putting the funds as carrot, but at the same time working with the states, providing technical assistance to each of the states of the federation. working with the partners to ensure there's increased funding from their own side as well. And at the same time, coming together between the federal government, the state government, and the partners at every state level to ensure that processes towards attaining this improvement is actually put in place.
Let me get you correct. You said there is increased funds from there's something else we're seeing, boost of funds from 500 million. That hasn't been assessed. Why are we seeing more funds when they're not, being utilized as well?
Now, for example, I can give you a clear example. There's some states actually in the 2016 disbursement that they achieved improvement. Their funds is still lying in the central bank. You'll be shocked to know this. It is shocking to us also. In fact, annoying to us as federal government of Nigeria that we have provided this funding for you. You have achieved improvement between 2015 and 2016 and earned up to $10 million. Some of the states still have these funds actually lying down in central bank.
Where do the extra funds come from?
From the World Bank.
So more funds and yet little results to show for it.
No, and that's why we're saying we want more results for the money that we're given.
So are you trying to help states in any way attain their targets? Because, if we're in this state at this point in time, 4 years after, and the result is not exactly impressive, what are you doing to help states?
One, working with the states to identify specific problems in the states. We did that using a model of bottleneck analysis, which we call the Kana model. What we do essentially with the state is to sit with the state officers to look at each of the indicators, look at where we are at the moment, what are the problems mitigating our improvement, where do we expect to be in 1 year for each state of the federation. I give an example. Elimination of mother-to-child transmission of HIV/AIDS. We want every pregnant woman to be screened for HIV. It is only when they're screened, those that are found positive, that measures will be taken so that babies will be born HIV negative. One, if women don't come for antenatal, certainly they will not be screened. If they come for antenatal, they must be screened. If they are not screened, then we will not be able to identify those who are positive. Now, that is how the bottleneck analysis goes. We identify what percentage of women are within reproductive age in a particular state. 1. 2, how many get pregnant? 3, how many access antenatal? How do we get all of them to come for antenatal? That's activity number 1. Therefore, we now take that to the end and even cost it. 2, those who attend antenatal, for example, how do we get them tested? We must get the test kits available. Therefore, the states must procure test kits and put in facilities to ensure that actually every woman that comes for antenatal gets screened. Those that will be found positive, what do we do thereafter? Now, taking all these gamut of activities, for each one, you identify the problem and the solution, and then you cost it. That is the bottleneck analysis. By the time you do the costing, and for each of the 6 indicators, you aggregate and have the total problem, solution, cost. All right, and that's exactly what we're doing with the states now. That's the technical assistance.
How many states have you successfully, monitored to find something significant?
100%. We work with all the states. We provided technical assistance through what we call the program support unit to all the states of the federation.
Specifically, how many states haven't shown any result?
50%.
Do you want to name any state?
I can name the states that have achieved improvement. The last survey that we did, the best performing state in Nigeria that also received an additional award of $1 million is Yobe State, followed by Osun State, Adamawa State, Kano State, Jigawa State, Gombe State, FCT, of course. FCT consistently, they've been improving. Kwara State, Bayelsa, Rivers, Cross Rivers, Edo State. These are states I can tell you off head that they have achieved improvement, progressively from 2015 to 2018 surveys that we conducted. Most of the remaining states did not achieve improvement. The sad part of it is that some states have actually moved backward.
So in summary, what's the restructuring about that will bring about anything significant?
Yeah, the restructuring currently is dovetailing more on the state. The ball is in the court of the governors. Federal government has done what it's supposed to do.
So they have to double up their game.
Really, the governors need to double up their game.
We must thank you very much, Dr. Ibrahim Kana. Thank you for coming on the program.
Thank you very much, Thank you.